This is the Mentor Breast Symposium here at BTS. It's a great session. We've got three internationally known speakers. We have Dr. Mark Pacifico from England. We have Dr. Sara Bengoa from Madrid, Spain. And last but not least, we have Dr. Yoav Barnea from Tel Aviv, Israel. It's going to be a great session. We've got hot cases to present to you. There's going to be a lot of energy and a lot of discussion. So we're going to get on with it.
So we just had a great expert session with the three of us presenting challenging cases that made us all, I think outside the box, think a bit laterally, present problems that all of us and everyone in the audience would think about, and enabled really good discussion and debate and challenges that we all face in our everyday practice. And I hope everyone learned something from it. I certainly learned from these two. So my case really is a situation where you've got very limited options, where if you don't have some lateral thinking tools at your disposal, you may be in a real bind. So I think we got a reasonable win from that case because of the surgical technique and using some form stable implants to help get that predictable outcome.
Well, I've been so lucky to be invited to this panel with these two great surgeons. I always learn so much from them because they presented us the most challenging cases, and they solve it in a way that it's not only good technically, but also good for patient expectations and patient desires, which is great.
I just thought that the it was not a correct dual plane because the implant, it was not settled in the lower pole. And I did a revision of that and I detached all this.
I think it was a great session. Three great cases of finding the right implant for the right patient and the right procedure. And there's not really right and wrong, black and white. There are a lot of finesses, a lot of options that we really need to find the best one for our patient. We want happy patients. We want patients that will, be happy after the result or outcome. And we saw that there are many finesses, many small details to really bring this good result to the patient.
Healthy, sporty, she lifts weights. She is 15 years after breast augmentation. She had Allergan, anatomic implants, 375 mF, BioCell, and there was subglandular. And this is how she looks, raising her hands, lateral, semilateral. And she comes to the clinic. The implants, by the way, are intact. She wants smaller implants. She wants more of a natural look. She wants no rippling. She wants no animation. And the question is to the audience, will anybody leave the implant above the muscle? Somebody?
When the patient has some demands that you need to fulfill, if you want to try to fulfill them, what is very useful for me is over time you get a lot of pictures from patients, and I try to look for patients with similar conditions so that they can relate and they can see what we can achieve and look if she can work with that. Because if she sees the pictures and say, no, I don't like that, it's like, no, maybe I can get what you want. So that's been useful for me.
Yeah, I think they all had their own elements of challenging cases. We had one case that was Mark Pacifica's case as a patient that really needed to have a mastopexy done, but she didn't want to have it. And that sometimes can be difficult because the solution is something the patient won't do. And obviously in that situation, you've got to decide what you're going to do. If you're going to, not do the surgery, or you're going to come up with a solution that can still work for the patient, work for you as a surgeon. So that's what was ultimately done in that case. So that's its own kind of issue. It's more a patient issue. Another one of the cases was just a person with very thin soft tissue, and they had had implants on top of the muscle for a very long time. They're very athletic. They really weren't having a problem, but they just had a little bit of coverage issues, and the difficulty with this case is, what do? Do you increase the coverage by going under the muscle versus selecting leave the implant where it was since the patient was having any problems, which is what was ultimately decided. But then there's some interesting things to do in implant selection with some of the more newer Mentor devices that have a little bit less rippling because of their precision fill and or gel cohesivity, so that those things were also discussed. And the final case was actually just a patient who had the type morphology of her breast, where her nipple is a little bit lower. And what was able to be done is to select actually anatomic implant, a shorter height anatomic implant, which was able to position her nipple higher on the breast, which just gave her a better result. So I think they were all very interesting cases, actually very difficult. None of the revision cases are super easy, but they were, I think, very difficult, but all, I think, had really good discussion and good solutions ultimately for the patients.